FORA.tv. The world is thinking.
You've spent your life tying together the human side with the medical and technological side. How are you doing it now that you have to go into the White House?
Well, first of all, I think most people who know me would be surprised that I'm on a panel about the human side of medicine. So I think that I would say my bottom line is that we have, for the last 50, 60 years since the end of World War II, and our very big investment in biomedicine through the NIH and others, have really emphasized high technology medicine, whether through organ transplants or intensive care units and all the advances. And I think we have lost the high touch part of medicine. And I think part of what we need to do over the next decades is to shift from high tech medicine to high touch medicine, where technology at best supports, but doesn't take center stage. I do think that the last 50 years, and the reason this draws so many people, and you even have the theme here, is because we really have been focusing on the high tech as opposed to the high touch. And I say this as now a newly minted green eye shade guy at OMB, not as a humanistic doctor, because if you look, the real challenge for the healthcare system is, can we get higher quality at lower costs? That's the holy grail, and how do we do that? And if you look at where the high costs are, they are in chronic illness, coronary artery disease, congestive heart failure, emphysema, diabetes, asthma,
Cancer.
And cancer. Those, if you take those 6 diseases, those are very expensive, and the main expense is we don't do a good job of keeping those people healthy and out of the hospital. And then there are a whole series of procedures where we have a lot of discretion: knee replacement, cabbages, coronary procedures. And those 2 buckets are where we really need to focus our attention if we want this high quality at lower cost. And then you ask yourself, well, how do we get those combinations? How does it work that we can get high quality at lower cost? And one of the things you do that happens, if you look in the literature, almost all of it involves high touch rather than high technology. And let me give you sort of 3 streams of data, since I'm a data-driven guy, on this. If you look at companies that have done a lot of intervention on their workers and gotten them really healthy and reduced their healthcare costs, reduced their disability costs, improved their performance on absenteeism, so it's the Johnson & Johnsons, the Pitney Bowes, those companies, almost all of them, have put in some on-site, high-touch care. They've got doctors who are spending 20, 30 minutes with people who have chronic disease at an appointment. It's not the 7 minutes or the 8 minutes. It's a lot of time. And then they involve them with the team, including people like Tina is talking about, people who talk about their life and their lifestyle, because it's that way that they can get lifestyle changes in these people: more exercise, better eating, etc. Similarly, so that's on-site docs. Similarly, if you look at the so-called disease interventions, disease management, the only ones that work are the ones that are face-to-face, people-to-people, more human. The technology, the robocalls, the computer-based stuff, no effects. It's all face-to-face interaction that is the catalyst for moving people to take control of their own life and
Well, let me interrupt real quickly, because Gerard had said about getting people to the home and monitoring them remotely. How do you square that circle?
So I think that's exactly the right thing. So technology can help in some of these cases, but it should never take center stage. So, for example, I don't know whether it's your company or other companies have these pill boxes where they're radio controlled, so that if a patient doesn't open it, isn't taking their pills, goes back to a central monitoring, and then some person who they trust can intervene. Or, as you point out, other people have produced scales for people who have heart failure, and if they're gaining weight, it is recorded to the hospital or a loved one, and they can intervene. When technology takes center stage, we almost always lose the patient. When technology supports this idea, I think that's when it's going to be successful. That's when we are actually going to be able to have this higher quality at lower cost. But